Let's take a look at an objective assessment for a client complaining of hamstring pain. Now remember, the hamstring crosses two joints, the hip and the knee, so we need to bear that in mind when we're doing our active resisted and passive stretching. We're going to target the hip end, the origin, and the insertion at the knee. So we're going to do both straight leg and bent hip testing. As with all of our assessments, we will do a visual and palpation assessment of the client's location of pain. But what we're going to do is run through those 3 additional tests that we discussed in this module. An active contraction of the target tissue, a resisted active contraction of the target tissue, and a passive stretch. And that's to give us a little bit more information on the behaviour of the tissues involved. Is it indicating that it's likely to be tendon, muscle, bursa, joint, or ligament? Next up, we're going to do a quick look at a client who complains of hamstring pain. In particular, they're reporting pain towards the back of the knee that sometimes radiates around towards the front, but they very much describe hamstring stiffness, tightness, and pain when they play certain activities. So it's unclear to me what might be going on. I've done my SOAP assessment, and this is an extra piece I want to add in. So I'm going to look at the pain behaviour of the hamstrings. Now remember, the hamstrings is one of those muscles that crosses two joints, the hip and the knee. So I'm going to look at those 3 tests, active, resisted, and passive stretching, but in 2 different positions. One targeting the origin at the hip, and the second targeting the insertion at the knee. So if we look at the hip first, the hamstrings is an extensor of the hip. So my first test is going to be an extension of the hip. So I'm going to just remove the pillow or keep it under the leg that we're not testing. Okay, keep it free on this side, just to allow the client to move with greater ease. And now, keeping your leg straight, can you just raise it up a few degrees for me, please? Any pain? And where do you feel the pain? And relax back down. Okay, and we're looking for the client to describe where they're feeling it, because that's the differentiator between muscle and tendon, for example. If he's feeling it towards that tendinous attachment, that's a key piece of information. Whereas if he reports pain in the mid-hamstring, muscle belly, we're talking more about muscle. Next, resisted contraction. So I'm going to place my hand gently on the back of the client's leg, and again, straight leg, can you raise it off the bed? Raise your leg up into my hand, that's it. Any pain? When and where do they feel the pain? And relax. Lovely. Again, if they're not feeling pain on a resisted contraction, I'm suspecting it's something more local to the joint rather than the muscle or tendon itself. The third test we would want to do is to then stretch that hamstring. Okay, so make sure that they're relaxed, keep it nice and passive. And I'm going to bring it onto end of range. So this client's range is actually quite restricted in terms of hamstring. And then I'm going to ask, do you feel pain? And when and where do they feel that pain? Again, we would suspect if it was tendinous, they would feel it towards the tendon. And if it was indeed muscular, they would feel it in the muscle belly. Given we're not at a great end of range, I would suspect that in this case we would not be able to reproduce the pain if it was a joint capsule issue, because we're actually not into end of range territory for this joint. And now let's focus on the knee attachment. So this time we're going to look at flexing the knee to contract, focusing on the hamstring insertion below the knee. So I'm just going to ask my client to slowly bring their heel to their bottom. Do you feel pain? Where do they feel the pain? And when do they feel the pain? So is he feeling it at end of range, or is he feeling it on initiation of that contraction? So key differentiator between muscle and tendon versus, for example, ligament and joint capsule. Again, an active resisted contraction. I'm just going to bring his leg to mid-range so it's comfortable. Place my other hand on top, and now try and bring your heel to your bottom. Any pain, and where do you feel that pain? And relax. Okay, and then we want to stretch, focusing on the knee attachment of the hamstring. Again, I'm going to do that in supine, but I'm going to do it with the knee, with the hip flexed to 90 degrees, so that we're focusing on the knee attachment. And as I extend the knee to end of range, Do you feel pain, and where do you feel pain? And again, I would suspect that to be in the tendinous region if it was a tendinous problem, or into the muscle belly if it was muscle. Don't forget that our eyes are also one of our assessment tools. And as with any injury, level 3, level 4, when our clients complain of pain, we want to do a visual assessment of the area in which they complain of pain. We're looking for red flags. We're looking for signs of inflammation, fresh bruising, swelling, redness, even clamminess, so we want to touch that tissue. So don't forget the tools that you already have for helping you identify whether this is something you can work with or whether or not you need to look at contraindications, referring onwards, or even local modifications.